think McMurray's is on there. So
Yeah.
the original true McMurray's, I hyperflex. Think about like a horseshoe. So when I come medially, I'm externally rotating. When I come laterally, I'm internally. Right? All right. Yep. Okay. And then I keep doing this as I'm extending to how far? 90 degrees. Now it's primarily posterior horn is what you're looking at. I'm compressing. Okay. So that's positive sign is what?
Concordant sign. All pain.
Pain, concordant sign, right? Reproduce their symptoms. I could get some clicking, right? What if there's no pain with the clicking?
We're okay. Ask them if it's normal.
Check their other side.
I would think that if it's the clicking is the meniscus, they should have pain with it. Okay, but there might be some clicking, but I'm trying to reproduce their symptoms. So when I externally rotate, I internally rotate. Internally rotate is going to be more lateral. Externally rotate is going to be more medial, right? I don't know that you need to explain that when you do it. I want to see that you do it correctly and what a positive sign is. Okay?
Extra credit if we do.
Extra credit.
I'm with that.
I'll think about it.
Hey.
All right, so
Thessaly's is
Put
next.
it out there.
Thessaly's. So how do I do Thessaly's?
Slight
You
bend.
have the patient slightly bent about 20 degrees.
20 degrees.
You have them stabilize them, and then you passively move them, I guess.
So
yeah,
I
actively,
direct them
in a direction.
internal, external rotation. True?
Mhm.
And what's a positive?
Concordant
sign.
sign.
Concordant sign. Good.
Yes.
Steinman's too.
Steinman's 2.
Toes.
So there was a Steinman's 1. We're going to do the Steinman 2. So Steinman 2 is I have to find the tibial plateau joint line, and I bring my thumb into the joint line, and I can go medial and lateral here. Where are the meniscus typically tear? Medial or lateral?
Medial.
Why?
Yeah.
More
No.
space because it.
So the other one's all circle.
Somebody said that.
One's C
You
and
told me that,
one's a
didn't
circle.
you?
So what?
So-
That was
you told me
true.
that.
It's true. It is C-shaped, but that isn't why it tears more.
Because there's.
Because
Yeah.
Space
It is.
Space.
It is bigger.
Because the femur internally rotates.
Well, you have you're talking about screw home mechanism.
Because
True.
Because the MCL is attached to it.
Correct. MCL and the capsule. So in other words, were you saying that and I didn't hear you?
Well, I said it.
Sorry.
Whispered
So the medial meniscus. Well, doesn't that make sense? So the medial meniscus is attached or kind of stuck, fixated, more so than the lateral is fixated to the MCL and the joint capsule. So it doesn't have as much give. So that's, at least in theory, why they think we know that the MCL tears more. And so that's the theory as to why. So anyway, here we go. So I've got my thumbs curled into the joint line. Okay? If I passively extend and passively flex. I passively extend, what should happen to the pain?
concordant.
Increase. Decrease. So I do both, because this should decrease, this should increase. Then that would be a positive test. Got it?
Edges.
Oh, show us, Julie. I might do it wrong. So external rotation, is for
Medial.
Mhm.
medial. And how far apart are the feet?
Shoulder width.
Shoulder width apart.
Okay.
And a positive test would be
Concordance.
concordance sign,
Yeah.
right? And there is there was one study, right? One that's okay.
Yeah.
So you might make the argument that would be worth doing, I think. I think it might be. I think Thessaly
Along with everything.
might be worth doing. And then I think I mentioned posterior horn, maybe the original McMurray's. Anterior horn, these tests aren't, well, the Simons maybe. You could also, this is not an exam, but you could also hyperextend their knee and kind of hold it for a while. See if that brings on their symptoms. Then it might be an anterior horn. Anyway, that's it for the meniscus?
Yep.
Okay. Then it's the
ACL. Lockman's.
Lockmans. So we all know the Lockmans, right? So some of you maybe are using a knee and some of you not. Are some of you always using the knee?
For the most part.
Just depends.
Pretty much.
Or are some of you always?
Always.
Okay, that's fine. You getting used to it?
Yeah.
And
My
so,
hands are too small too.
I don't have an SEO.
not much. Not much. So I do it very, very quickly, right? Because
Okay.
I'm looking for the integrity of the
And
ligament. So a
feel.
positive sign would be
No infield or excessive laxity.
lack of an unfeel.
And will there be pain too?
No. Probably not. Well,
Sometimes they're probably just.
It can be
already-
uncomfortable, but
Yeah.
it's not really.
Oh, okay.
that's not what we're looking for.
Okay.
Like what?
The positive sign is I'm not getting integrity of that ligament. Now, there are those, in fact, physio tutors might have even mentioned that they look at the amount of translation, but I think I gave you that example, didn't I? Of that patient that had a lot more translation in the one, and it was intact. So don't bank on that. I'm looking for the integrity of the ligament.
Alright, sorry guys, my shoes. We were just talking.
Those are your shoes?
Yeah, you know the Air Max and the Air is not as max.
They're maxed out?
Yeah.
What are those shoes
You got a
buy?
flat tire on
I
them.
know I do.
All right, so everybody gets Lockmans.
Yes.
Have you had a lot of practice at your clinical sites?
Not an actual, but
Not
just
so much?
playing around.
Oh man, you
No.
need to practice that a lot. But the good sign is that I think you guys were getting the hang of it in the classroom pretty darn well for the first time, so that's good. Okay,
A lot of knee
because
injuries.
yeah, okay, so that's a really critical
Quite a few.
test.
Pivot shift.
Pivot shift.
Oh.
So pivot shift, and I'm not looking at reverse, just regular pivot shift. So what I want to do is I want to sublux this initially. So how do I do that?
Internally rotate and a
Internally
valgus.
rotate it. So now I subluxed it. I subluxed it anterior medially. What else? What do I do with this hand?
You valgus,
Valgus stress,
and then you flex.
flex, and what's going to happen?
It's a clunk.
Clunk. Why?
Because that IT
So
band.
IT band is now a flexor, and it brought it back. So a positive sign is
The clunk.
clunk. Is a positive sign integrity, or now will they have pain with that?
Yes.
Probably, yeah.
Lever.
But that's not what I'm looking for. Positive sign is clunk. Lever. So lever
Jump
is.
the gun.
Slow down.
So what do I do with the lever? Lever's a good one, right?
Yeah.
You wanna put your fist.
Unless you got a
under your
PC.
chest.
So, so lever is kind of this,
Yeah.
and
You're pushing down quads.
and what would be a positive sign?
Flip it down.
If the heel does not.
Heel won't come up.
Mhm.
And I should have thought of this test.
Yeah,
I
right.
wonder if that guy made a bunch of money off
Oh,
it.
you would
Probably
think
not.
so.
I don't think. He's a surgeon anyway, he doesn't care.
Hey,
He doesn't care.
Um,
Doesn't need the money.
What's the other one?
Anterior drawer.
Anterior drawer. So should I sit a little bit on the foot?
Sit on the foot,
A
yep.
little bit on the foot. where do I have my thumbs kind of right above the
the-
plateau,
yeah.
maybe on the condyles. And what am I looking for?
Translation.
I'm looking for
Translation.
translation on this. I'm not gonna get an MPO, really. I'm looking for translation, so what's a positive?
Translation.
Just jumping at you.
More than-
Oh, it's too much
Greater than
in.
the other one. I'm gonna compare. So I'm getting greater translation than the other contralateral. So that would be the positive. I'm not looking for pain, I'm not looking for integrity of ligament. Good?
Valgus,
Oh,
other.
the stress test. So valgus would be for what ligament? MCL.
MCL.
So I wanna start out with, I wanna create some slack if I can, right? So which way would I go with the tibia?
So you're going towards you.
Me, towards here or towards?
Towards lateral. You're going lateral.
I'm gonna put a force this way, aren't I?
Inwards, yes.
So I'd go medially with the tibia, wouldn't I?
Going you.
I'm grabbing posterior knee, true?
Mhm.
I'm gonna go medial with the tibia, cause I wanna try and create slack in here if I can. Then I go laterally quickly, right? Cause I'm checking for the
Enfield.
integrity, right, the
Integrity.
end-field, integrity of that ligament, okay?
That is.
And not a concordant sign necessarily, although they may have pain there, but I'm looking for the integrity of that ligament. So that's the valgus.
And then Barrett's.
Well, next is noble.
Oh, elbow.
Noble,
On this list.
so noble's for what? IT band. So where do I put this hand?
Just proximal to the.
I don't wanna put it right over the condyle, do I? Cause they're just gonna have pain there, so a little bit proximal, okay? And then flex. And when they go into extension, where might they have symptoms?
Right where your hands at.
30-degree range.
But at what range? should they
20
be?
to 30.
Yeah, right in there, 20, 30 degrees. They will have, what's a positive, so positive sign is?
Concordant sign.
Concordant sign at 20, 30 degrees. Concordant sign at 20, 30 degrees.
When doing this test, are you supposed to go over the person? They stand on the opposite side of the leg.
Yeah, you better be on this side, yeah.
Okay.
Be hard to do from that side. Okay, so concordant sign.
Moving patellar apprehension.
I showed you that one.
Yep.
Yep.
We're good.
Questions? So you do it both laterally and medially. They'll have
Yeah.
a concordance. I'm looking for a concordance sign where they may apprehend, they may say, don't do that, or they may contract their quads to prevent you from doing, when I go laterally. Medially, nothing. So I need to do both, passively. Got it? They don't act, I passively do it.
Martins.
Martins. What's Martins for? Plica. So I'm gonna flex her knee and find the condyle, femoral condyle. When I find the femoral condyle, I'm gonna go superior and laterally with the patella. See that? I put my other thumb over that thumb to reinforce the pressure. Then I flex and extend. Basically, my thumb is replacing where the movement of the patella is going to go. Flex and extend. And what's a positive sign?
The concordant sign.
Concordant sign. I reproduce their symptoms.
Onto the hip. The fader.
Fader.
What is it?
Which, so what would this be for?
For the hip.
Labral. So flexion, adduction, internal rotation. And you could give some axial load. Axial load too, typically.
Thomas.
Thomas, which one's Thomas?
Off the edge.
And so very edge, you got the very edge. Okay, so what am I looking for?
The other leg lifts up off the
So I could be looking for,
You can have
So with the
multiple,
Flex-
either hip off the table or leg off the
so
table.
what might this mean?
Yeah,
Flexor, so what might this mean?
Quads.
Quads, and what might this mean?
IT hands.
And or, that's muscle over here.
Tensor fasciae.
Tensor fasciae. Okay, so what else might I be looking for with the Thomas test? They have pain with it. So they have hip pain. What's that mean? Exactly. Thomas test is not bad for hip labrum tears, labral tears. So if that reproduces their hip pain, that could be a sign of a labral tear.
Favors.
So Favors is this one, right? So I'm putting, it's like a figure 4. Foot is proximal to the knee. Do I stabilize anything? ASIS, opposite ASIS, and I go posteriorly with the knee. And what if I can't go any farther than this?
There's positive.
Positive 4.
Everything.
Hip pathology, stiffness,
SI.
it's not specific for anything. So remember, so this would be a positive sign, right? Of a hip pathology or stiffness.
Hip scour.
Scour is,
McMurray's for the hip.
yeah, it's McMurray's for the hip. So I'm flexed. I internally rotate, externally rotate, internally rotate, externally rotate, and I'm scouring the superior labrum.
Would you put an axial load on that as well?
You could. And what would a positive sign be?
What?
You just wanna hurt these people.
Pain, reproduction of their symptoms, concordant sign.
That's it.
Questions? Did I